Good morning, everyone. I'm Paul Irwin, Dean of the School of Public Health here at UAB, and I want to welcome all of you to UAB, the host site for the 2026 Jefferson County Department of Health's State of the County's Health. Thank you to everyone who is joining us in person and to those joining virtually via Zoom. First, we are honored to have state and local elected officials in attendance. If you are an elected official, would you please stand? Yes, thank you. Thank you for your leadership and for everything you do for our communities. Next, I would like to acknowledge our current and former health officers and deputy health officers. If you are with us today, please stand so we can express our appreciation for your service and commitment to public health. And last, but certainly not least, if you are a current, did that just turn off? Maybe it didn't turn off. If you are a current or former JCDH employee, please stand or give us a wave. You got that wave down. I love it. We are deeply, deeply grateful to all you have contributed to Jefferson County and to the state of Alabama. For the past several years, the UAB School of Public Health has served as the host site for the Jefferson County Department of Health's State of the County address as part of National Public Health Week, and we are thrilled to continue the tradition. For more than 150 years, public health has reshaped what's possible in this country, driving improvements in health, safety, and quality of life. These accomplishments didn't happen by chance. They were achieved through science, collaboration, and the dedication of people committed to strengthening the health of others. As we celebrate National Public Health Week 2026, we're reminded that progress is never automatic. This year's theme, Ready, Set, Action, encourages us to reflect how far we've come and to stay focused on the work ahead. Because one truth remains constant: good health doesn't just happen. It is created every day by individuals like you who serve, support, and protect our communities. So thank you for all that you do this week and every week. I would like to introduce today's speaker, Dr. David Hicks. Dr. David Hicks is a board-certified family medicine physician and serves as health officer and chief executive at the Jefferson County Department of Health. At JCDH, he served as Deputy Health Officer, Incident Commander for JCDH's COVID-19 response efforts, and was Medical Director of Adult Health and Family Planning. Prior to working at the Health Department, Dr. Hicks served as Chief Medical Officer at Birmingham Healthcare, overseeing 5 clinic facilities and an academic health system. He is a fellow of the American Academy of Family Physicians, chairman of Alabama's STD Medical Advisory Council, and a member of Alabama's Rural Medical Service Awards Advisory Board. Dr. Hicks is a graduate of Leadership Birmingham and is a member of the Freshwater Land Trust Red Rock Committee, the Kiwanis Club of Birmingham, and the UAB School of Public Health's Community Engagement Council. In 2021, he received the NAACP Metro Birmingham Branch's Community Trailblazer Award. Dr. Hicks earned a Master of Public Health degree in Behavioral and Community Health Sciences at the University of Pittsburgh Graduate School of Public Health and was a National Institutes of Health Fogarty MIRT program research trainee at the National University of Science and Technology in Zimbabwe. He later earned his Doctor of Osteopathic Medicine degree from Rowan Virtua School of Osteopathic Medicine and completed his family medicine residency at Christiana Care Health System, where he also served as chief resident. I'm very honored to introduce him today and welcome him to UAB's campus as part of National Public Health Week. Dr. Hicks.
Good morning, everyone. My name is David Hicks. I serve as Jefferson County's Health Officer, and I really appreciate you taking out the time to be here for my remarks. So today I'm going to give the state of the county's health address and update. We need to think about what is the data telling us? What are the pressures we're facing? How do we continue to advance public health practice in these challenging times? My goal is to be practical. What's changing? What's working? Where collective action matters the most. So I'm going to start off and talk about the headwinds that public health leaders around the United States of America are navigating right now. As you all know, public health is operating in a constant change environment. There are major pressures shaping what communities can do, what they cannot do. A few examples. There's erosion of public health infrastructure and funding. Public health leaders listed around the country are operating amid significant federal and state funding instability. This includes shifts in HHS and CDC budgetary priorities, the elimination of categorical grants. Federal agencies are reorganizing. This is disrupting the continuity and institutional memory that we've all come accustomed to. These changes certainly may weaken our preparedness activities, our surveillance efforts, our prevention capacity. It can strain the state and local health departments that already oftentimes operate on thin margins. There's issues with workforce shortage and burnout. Health departments around the country face persistent vacancies in key areas. For example, there's epidemiology and nursing, environmental health, informatics, and emergency preparedness. There's competition with the private sector. Short-term grant funding, burnout following COVID-19 pandemic. These continue to be challenges when we're trying to recruit a workforce. We want to retain our workforce. And there's reductions in the system's ability to respond to just the routine and the emergent issues of our times. We know we have to rebuild the public's trust. We have to counter misinformation. The public's confidence in public health remains fragile. There's vaccine hesitancy, science denial. There's organized health misinformation that undermines our core functioning. There's examples like what's happening with immunizations and outbreak containment and emergency response. There's a resurgence of measles around the country. Additionally, other vaccine-preventable diseases have seen an uptick. So this illustrates the tangible consequences when we erode the trust in these institutions, when we politicize what public health is. There's rising burden of chronic diseases, mental health conditions. We know this. So heart disease, it could be diabetes, obesity, mental health, substance use disorders. These continue to drive the morbidity, the mortality, healthcare costs. And some public health officials really struggle to shift the systems toward prevention while resources are increasingly absorbed by treatment and crisis response and these downstream consequences of the social and economic stressors. We know about environmental health threats. Give you some examples: wildfires and extreme heat, flooding, vector-borne illnesses. These are all things that are facing our community across the United States of America. And then there's pressures with data monetization and surveillance gaps. So there has been progress, but with public health data, our systems still remain fragmented. There's a strain on our system, so we're expected to collaborate and work together related to the data, but we have to have the infrastructure in place, and we need the resources to put that in place. We also have to figure out how do we leverage these new technologies like artificial intelligence. We have to maintain the privacy of the people that we serve. And oftentimes we're working at times with incomplete data sets. These are challenges. Related to emergency preparedness, it seems like we're always in these constant crises. So we have public health officials that have to not only plan for one type of emergency, but there may be an overlapping emergency that they're also dealing with. Now, we know that our communities, what do they expect? They expect us to have rapid response. So we don't have the luxury of delaying to put our resources in action towards the betterment of the people. And then we have to navigate the political and the policy headwinds that are out there. There's an increasing politicization of public health. The evidence-based strategies that we all know are being challenged. How do we look at our data? How do we apply an equity lens and making sure we're doing things appropriately? We have to balance our legal authority to do things in public health. We have to maintain scientific integrity. The public has to hold us accountable. And then we're rapidly evolving to the changes in the political landscape around us. So why does this matter in Jefferson County? Well, we still face persistent disparities. We know these social and economic drivers shape outcomes that we all experience. And then we're in this post-COVID-19 pandemic world where now we have inflation and we have workforce shortages and we have all these pressures that are on us. So our path forward depends on having an equity-centered leadership, partnerships, shared data. So now I'm going to transition, right? These are the broad headwinds I was talking about across the United States of America, but what does that look like on the ground here in our community? There are these practical constraints that affect how we plan our services, how we deliver those services in our community, especially for local health departments. I want to talk about one example is the funding instability. So, as you know, on the federal level, there's been repeated budgetary brinkmanship happening. Temporary funding measures are there, and there's uncertainty around discretionary public health dollars. That just strips our ability to plan and staff and have long-term investments. In 2025, Jefferson County organizations lost millions of dollars in federal funding. As an example, at our local health department, we lost a CDC health disparities grant, and we lost a portion of our epidemiology and laboratory capacity grant. We're just one entity, but we know that there's many cases in our local community. There's been some fragmentation on the guidance that we received as there's been changing times in our nation. There's been an evolution in some of the recommendations related to infectious disease control, vaccinations, emergency preparedness, and we have those challenges to figure out how to implement those changes in this new landscape that we're in. There's this increased divergence between what federal guidance may have and perhaps state and local in our approach. And I think nationally we've seen a shift from having a centralized public health approach or going towards a more of a centralized approach to more is relegated to more the local, state and locals to adapt to this changing landscape. And we have these compounding community pressures. I alluded to this earlier. There's food insecurity, economic stress, trust erosion and misinformation, climate and environmental burdens, mental health and public safety challenges, substance use needs, and finally, expectations keep rising. We're asked to address the social drivers of health like housing and food access and transportation. So with those realities in mind, it's worth remembering what public health has already achieved and what we can protect and build on. Many of you in the room are familiar with this. These are the 10 greatest public health achievements over the last century. These achievements are a reminder of what prevention and population health can do if we do this together. But these changes have been manifested over time. This is over decades. So as you can see, vaccinations, motor vehicle safety, safer workplaces, and infectious disease control. There's been declines in heart disease, strokes, and deaths related to those. We have safer foods, healthier mothers and babies, family planning, fluoridation, recognition that tobacco is a problem substance in our community. So in the next few slides, I'm going to highlight a few of these areas that remain central to our county's health strategy. And I'm going to start with vaccines. Okay. Vaccines remain one of the most effective population health tools that we have. This protects individuals and it strengthens communities' resilience. This is also one of the areas where trust and misinformation pressures have real consequences. So communication and access matter. We have seen an increase in parents opting to not vaccinate their children. Like surrounding states, we are likely to experience a resurgence of childhood measles cases in the future. What are we doing? At our local health department, we are refining our plans on how to effectively respond to a measles outbreak. Now, another longstanding prevention success is community water fluoridation. As you saw before, water fluoridation is highlighted among these major public health achievements because it reduces tooth decay at the population level. Nevertheless, statewide, more than 1 in 5 kindergartners and nearly 1 in 4 third graders in Alabama have untreated tooth decay, and that exceeds the national average. We know that communities with fluoridated water experience approximately 25% fewer cavities. For every $1 invested in community water fluoridation, about $20 is saved in dental treatment costs. So, what do we need to do here in our community? Well, at least we need to increase our efforts to screen, particularly young people, for dental tooth decay and link them to treatment. Now, let's turn to a social driver of health that affects families every day, and that's food insecurity. 16.7% of Jefferson County residents, that's nearly 1 in 6 people, so 1 in 6, are unable to reliably access enough food. This is food insecurity right now in Jefferson County. Many of the most affected areas where food insecurity exceeds 30%. There's some parts of our community where it's 45%. We're talking about communities like Birmingham, Bessemer, Tarrant, Fairfield, and Midfield. Food insecurity is not just about hunger, it shapes chronic disease risk, stress, and family stability. Last year's federal government shutdown did not create food insecurity in the county, but it intensified it by interrupting income, complicating benefit access, and overwhelmingly, the local food safety net stepped up, but they were under extreme amount of stress. And that was at a time when there was already a high level of need in our community. I will say I'm very grateful for our community organizations, you all, that fill that gap. And as you know, in Jefferson County, we're one of the most philanthropic communities. And when there was a need, we stepped up to make sure that that basic, essential component, food, was not a barrier to people just living in our community. So I really appreciate that. Now, to talk, and I'm going to shift here, to talk responsibly about health, we need to be clear about how health is measured, and then how do we interpret the trends. Now, we use multiple data sources, so we're not really relying on one imperfect signal. We have to kind of triangulate the data, use different sources to really get an impression of what the health is in our community. So we have local surveillance efforts. That provides the context that we need, and especially when we're looking at multiple years trends. Now, the point isn't just ranking a county just for the sake of ranking a county. The point is that we have shared data that drives constructive conversations and accountability. So with that measurement lens, here's where Jefferson County shows up, and this is in external rankings. And I like to go over this annually. You know, one of the frameworks you see county health rankings. This is built on 92 metrics across multiple categories. We also monitor other comparative platforms, as you can see referenced here. This is a new one that I recently learned about. Now, again, these tools that we have give us a signal of the impression of what the health is in our community. Can identify where we're improving, where gaps persist, and what to prioritize. So let's see how we're faring. In 2024, as compared to 2025, this is county health rankings. In our county, it's demonstrating that we see some modest improvement in our overall health outcomes year to year. And remember, there's a data lag as they collect the data. But if you can see on the right side, compared to the previous year, it says that in Jefferson County, it's faring slightly better than the average county in Alabama. So this is based on county health rankings, which is funded from the Robert Wood Johnson Foundation. I think there's two kind of key messages underlying this. Equity remains central to what we need to do, and our overall outcomes are heavily influenced by premature deaths. And this is the data underlying this. So we do have some recent successes. I'll show you in a little bit. So as a community-wide approach, our strategy needs to do two things. We have to protect the gains that we've made, and we need to focus energy on what drives early deaths and avoidable harm. So let's break that down. Let's break it down to the health factors and community conditions. What's better? What's worse? What does that imply? Okay. So again, this is county health rankings. You can see the comparison between these 2 years. This is just another way to review what's driving the rankings. And here's some things that stand out. If you kind of look at the data that's underlying this. Now, some of the areas of strengths. Primary care providers and dentists, we have more relative than other parts of the state here in our community. So that kind of nudges our numbers up. The food environment index is better than the state, but it's worse than the overall United States' number. And I talked about food insecurity before. Food insecurity is better than the state, but worse than the United States. So we do have the food insecurity here, and it's sad that other parts of the state are a lot worse. This also can highlight some priority gaps. So I talked about the food. Limited access to healthy foods is worse than both the state and the U.S. And there's some things that we've dealt with for a while. You all know about this: sexually transmitted infections, drug overdose deaths, children living in poverty, injury deaths are worse here than the state and in the United States at the time of this data. Mental health. We actually have more mental health providers in Jefferson County relative to other parts of the state. But we don't have as much as we should have relative to the whole United States of America. So there's still some capacity challenges there. So this can give us a signal of where we should focus prevention efforts, partnership efforts, and targeted strategies that are going to give us the biggest payoff in our community. So there are other ways to measure health. I just saw this last week, right? Niche has ranked Jefferson County as the third healthiest county in the state of Alabama. Now, what are the factors that they looked at? And I'll give you a list of different factors. So they're looking at things like physical inactivity or obesity in the community, access to care. Do we have excessive drinking rates, or what are our smoking rates? How many people in our community are uninsured? Do we have access to recreation and fitness? What about drug-related deaths and premature deaths? Okay, so the previous points I was making, you can argue to say that was pretty kind of depressing, dire, what's happening in the country. But there are bright spots. And so despite all those things, we are doing a very good job, relatively speaking, in Jefferson County. So I want to kind of anchor the momentum in what's working and where we're seeing measurable improvements. Okay. I want you to look at this. This is a progress slide. We're seeing meaningful reductions in key outcomes from 2024 to 2025. And these improvements don't happen by accident. They reflect coordinated work and sustained focus. Infant mortality rate. From last year to this year, our infant mortality rate decreased by 29%. And I believe that this is the all-time low in our county, but I have to verify that. But underlying that, there remains disparities in the outcomes. So white babies versus black babies, there's still a disparity that we need to close that gap on. I applaud the coordinated efforts in our community. There's a maternal child health roundtable group that shares their lessons learned as they're engaging with people that have these challenges, and they actively explore ways to collaborate. Some notable examples in our community that are helping to provide wraparound supportive services to expectant mothers include the Nurse Family Partnership of Central Alabama that is run by the UAB School of Nursing. And our health department has a From Day One program that leverages community health workers to also try to make a difference. Those are just a few of the many efforts that are happening in our community as we're facing these challenges. You see homicides. So overall in all of Jefferson County, the homicides have dropped by 34% year to year. Okay? Now, we know that most of the homicides occur in the city of Birmingham, and recently the city of Birmingham reported a 44% drop in homicides from last year to this year. And in year to date, in this first quarter of this year, they've reported a 48% decrease. Now, another good news, we also continue to experience a decline in opioid-related overdose deaths. Last year to this year, 40% reduction. We are expanding our access to naloxone, not only through our mail order program here at our local health department, but also increasing access to first responders, access in emergency departments in our community. We are putting access points in strategic locations in our county, and this is at no cost to the recipient that receives those resources. We continue to train faith leaders as a partner with us, and they help us get the word out. The Recovery Resource Center of the Crisis Center remains a key ally to link people to treatment and recovery resources. I want to pause here, and I want to ask Dr. Mark Wilson to stand up. Please stand up. He doesn't know why I was going to have him stand up. But when you see this is in part largely to the efforts of Dr. Wilson's leadership and partnership work with all of you in the community, where this is proactive investment years in advance. And so sometimes we don't see how the outcomes get manifested immediately because it takes time. So Dr. Wilson, I applaud you for you investing in your leadership, working with our community to make a difference. So what does it take to sustain this momentum, okay? It's not all doom and gloom, okay? So let's look ahead. And I think the following 4 principles I'll talk about, I believe is gonna guide us moving forward. Number 1, we need to have sustained public health focus beyond these yearly cycles to have a lasting impact, all right? Similar to what I just talked about previously, it's that we have to have sustainable investment. That takes a lot of commitment, a lot of buy-in, a lot of leadership. We need to maintain this forward momentum despite these challenges. We need to build on the lessons learned so we have stronger outcomes. We have to learn and evolve, grow. We have to have equity, health equity, embedded at every level to ensure these health improvements are manifested for all that live, work, worship, and play in Jefferson County. We must have community engagement and trust as the essential enablers for proactive and adaptive public health strategies. So this is the framework we should use to evaluate the initiatives and the partnerships that we're a part of moving forward. Okay, so now we're going to transition. As you know, every year, as by tradition, we announce a Public Health Champion Award. But before we announce the Public Health Champion Award for this year, I know everybody's waiting. We need to acknowledge an example of a key community partner that has been helping to drive the work, the progressive work in our community. So now I would like to invite Bryn Manzella, our Quality Improvement Officer at the Health Department, to the podium because we're going to present a special recognition at this point.
Thank you, Dr. Hicks. I am just thrilled today to be here. The Jefferson County Department of Health wishes to recognize the Community Roundtable as a strong voice for the community and for their support of gun violence prevention and intervention, driven to address Jefferson County's gun violence epidemic. Faith in Action, Alabama, created an open community dialogue on violence called the Community Roundtable. And y'all, it's the Community Roundtable, just so you don't forget that one. Led by Onoyemi Williams, who was with Faith in Action at the time, who is the leader, and facilitated by Dana Ellis, who is with Moms Demand Action. The group's Zoom meetings, which were weekly, explored gun violence's root causes and solutions, and they still do. In support of controlling gun violence and improving community safety, the Jefferson County Department of Health requested the Community Roundtable recommend a singular evidence-based gun violence reduction strategy that would be acceptable to our community. Supported by Dr. Jeff Kirby, who is UAB's Trauma and Acute Care Surgery Division Director, a hospital-based or linked violence intervention program was recommended. For those of you who don't know, hospital-based violence intervention programs, we just call them HVIPs, combine efforts of medical staff with trusted community partners who provide trauma-informed case management for violently injured persons to reduce re-injury and retaliation, thus ending the cycle of violence. Since the HFIP was launched in February 2023, the Community Roundtable remains a valued supporter of violence intervention and prevention. Please join me in welcoming Ono Williams and Dana Ellis to accept, on behalf of the whole Community Roundtable, this certificate of appreciation. And if anybody is here from, stand up to be recognized.
Yes. Please stand if you're affiliated with the Community Roundtable. Thank you.
Thank you so much for all you do for all the roundtable. And meetings are now bi-weekly, the first and third Thursdays of every month at 9 o'clock, and you are all invited.
All right. So, hold on, Bryn. Please stay. All right. I want to, before we announce the Public Health Champion, I want to acknowledge Bryn Manzella. Okay? So, Bryn has been a part of the roundtable on a regular basis, has been meeting and convening, and she is the person that's a driver of change. And she won't tell you because she's humble, but Bryn Manzella has been the person at the health department that has championed all the efforts that we've done related to community violence intervention, working with our community partners, has been a strong advocate, and challenging the system to say, what can we do with our resources to really make a meaningful impact? So typically when we acknowledge folks, we don't acknowledge our own people, because this is about, partners, but I want to recognize Bryn Manzella for all of her work, so please give her a round of applause. All right, so I get to announce the 2025 Public Health Champion. Now, as you may have surmised, the 2026, I should say, Public Health Champions are actively involved in violence prevention and intervention through this HVIP. So the 2026 Public Health Champions are, drum roll, Violence Intervention and Prevention Partners. All right. So Bryn Manzella is going to assist, so as we call up the key core partners, representatives, they'll come and they will receive acknowledgement, okay? Let me just make this remark. So, and with these partners, we're in this core group. This is the UAB Division of Trauma and Acute Care Surgery, the City of Birmingham's Office of Community Safety Initiatives, and the Offender Alumni Association, and they've done tireless efforts to reduce gun violence in our community. This program is more than just a partnership in name only. It's a sentinel part of the movement to restore lives and end the cycle of retaliatory violence in our community. It aims to achieve control of gun violence and improvement at the community level in our county. We know that programs like this hospital-based program, where you would expect that if you don't intervene, 44% of gun violence victims are expected to be re-injured. And that will require a return back to the hospital for care. And you would expect, based on data, that 20% of the participants or the individuals that were involved would be dead from gun violence within 5 years. As of last Friday, based on the data that I know, and this is for the inpatient arm of this program, they have served a total of 250 clients. There have been 3 gun violence-related re-injuries and 1 death since the program launched February 14, 2023. So that means it's only a 1.2% re-injury rate for program participants compared to what you would expect nationally. I don't know if anybody has any numbers like that in the United States of America. So the designated recipients for the Public Health Champion Award, they will come when we call the organization's name. So the first partner that's going to receive this award is the UAB Division of Trauma and Acute Care Surgery. Will Dr. Jeff Kirby, Holly Walter, Toria Petway, please come up to receive this award. Now, as they stand there, and they'll take a picture, I just want to give you a few things related to the UAB Division of Trauma and Acute Care Surgery. Now, through the dedicated leadership of Dr. Jeff Kirby, he's the director of the Division of Trauma and Acute Care Surgery. Holly Waller, she's the senior director of UAB Hospital's Trauma, Burn, and Inpatient Wound Services. UAB Hospital chose to offer eligible inpatients the opportunity to participate in this program. Toria Petway, who's a Trauma and Burn Services psychiatric social worker, has been instrumental in connecting gun violence victims to the services. So if there's anybody from UAB that was here that has supported this program in any way, please stand as well for you to be acknowledged. And so with that, thank you so much. Now, for awards, if you could just stand off to the side and remain at the front, slide down. Our second partner receiving this award, City of Birmingham Office of Community Safety Initiatives. Will Uche Bean please come to receive this award? So I'll say this, stemming from this program's successful pilot, the City of Birmingham's Office of Community Safety Initiatives, led by Uche Bean, has provided funding for the operations of this program. Further, based on the success of the inpatient HVIP, the Office of Community Safety Initiatives funded the expansion of the services for gun violence victims treated and released through the UAB's emergency department. And if anybody is here from the mayor's office, city council, or the Office of Community Safety Initiatives, please stand so you can be acknowledged as well. All right. Third partner receiving this award is the Offender Alumni Association. All right, so will Dina Dickerson, who's the Chief Operating Officer, please come up to receive this award. All right, so the HVIP services are provided through the Offender Alumni Association. They were selected in April 2022 to lead the case management component of this program under the leadership of their executive director, Deborah Daniels, who is not able to be here, but she sends her regards. Alabama's first HVIP launched, as we said before, February 2023. Since the implementation, 250 clients and hundreds of the family members have been positively impacted by this program. So if you are affiliated with all the staff from the Offender Alumni Association board members, please stand to be recognized. So I'll say this before you sit down. So any representatives from these organizations that are the public health champions, and if you can come up to the front afterwards, after Dr. Irwin dismisses us, and there could be some collective photographs taken. So you can all be seated after the photo. Let's give them another round of applause. I'm going to close with one final slide. Okay, so in summary, public health is facing some real headwinds. There's funding changes, workforce strain, trust challenges, and there's rising needs. Yet we're still seeing measurable progress when we stay focused and when we work together. So our next chapter is about sustaining the gains, embedding equity, and deepening our partnerships and our trust. So now it's time, Dr. Irwin. I'm going to have, if you can stand, if you're able to stand, please stand up, everyone. Please stand up. Please stand up. All you got to do is follow the words on the screen. We're going to do this together. All right. So, everybody Everybody's ready, right? You're going to repeat after me. I am public health.
I am public health.
You are public health.
You are public health.
We are public health.
We are public health.
All right, one more time and we're going to make this really stick. We're going to make this stick. We're going to make this stick. I am public health.
I am public health.
You are public health.
You are public health.
We are public health.
We are public health.
Thank you. You can have a seat. Thank you for your attention. Have a wonderful afternoon. I will turn it back over to Dr. Irwin.
Fantastic. Thank you so much, Dr. Hicks, and congratulations to our Community Champion Award recipients. Fantastic work, incredible, life-changing work, community-changing work. Dr. Hicks, thank you for your leadership and your commitment to the public's health. We celebrate the reductions, the improvements in infant mortality, in gun violence, in opioid-related deaths. And we also, at the same time, still acknowledge that there's work to do. There's work to do towards achieving health equity. For those of you joining us today in person, I want to personally invite you to a networking reception just around the corner, up and out, on the third floor, in the third floor ballrooms. As you make your way out, please be sure to pick up a bingo card. This is not gambling. We encourage you to visit each table, learn more about their programs, research, and initiatives, and ask the representatives to sign your card. Once you've completed it, drop it off at the desk outside the theater for a chance to win a pair of Beats headphones. We'll have hors d'oeuvres available for everyone, and I look forward to connecting you during the reception. Thank you again for being here. Thank you.